from Ogara.
Chairman, honorable members, Vice Secretary.
We cannot take that because we are not.
Laws are meant for men, not man for law. And I don't know of any law. I think that must be an obsolete situation, policy. I don't know. There's no. I have gone through the act of other Federal Medical Center, and there are exceptions. If you look at the population of the area, the topography of the area, the distance, there are exceptions to it. And there are states in this country that have more than one Federal Medical Center. And for anybody that understands and know Delta State, you know that Delta State is a mini Nigeria. That is why it's very difficult to develop Delta State, because when you're dealing with one city, the other city is crying. You're dealing with one. So Delta North, before now, used to be maybe 3-4 hours. You should be in Asaba from Ogara. But presently, with the condition of these roads, it's more. And again, talk about the insecurity. People, you remember the example I gave during my presentation, that somebody could be sick and you are taking the person and you are kidnapped along the road. So it is safer, in line with the trust of government, to ensure universal health coverage, to bring health facility closer to the people. Ogara is not just a town, it's not just a kingdom. There's a private university, and there is nothing like a federal university in that area or that we're talking about. There's no federal university in Delta State that is dealing with health activity. The only federal university we have is the Federal University of Petroleum Resources, which has nothing to do with what we're discussing. So there's nothing. The only thing anybody can say, oh, there's a Federal Medical Center, but we're saying that the time it will take a sick person under an emergency to get to Asaba is too far, too long, and anything could happen before then.
He has stated a lot of things that, of course, the Ministry of Health is in agreement. He talked about healthcare access. He talked about the population of his people. And of course, the federal government of Nigeria and the Federal Ministry of Health, they are working in tandem with the World Health Organization to achieve universal health coverage. And in order to do this, of course, we need to bring healthcare services closer to the people for them to be able to access it. So, Ministry of Health, in the spirit of achieving universal health coverage, will continue to work with this committee, House of Representatives, and the National Assembly in general to be able to achieve these requests.
When we get back to the committee level, we brainstorm and still consult further with the Federal Ministry of Health before we will now submit our final report to the House of Representatives. And be rest assured that we must do justice to the bill you have brought to us. We will do the ones we can do and now leave the rest for the committee of the whole House to take decision. And you know, after the third reading or whatever, it will still go to the Senate for concurrence before it metamorphoses into a law. So be rest assured, we must do all within our powers.
It's important for us to start this hearing with an open